First of all, we know that a lot of older adults die in hospitals, so that's in acute care settings. Probably between about 50 and 60%, it depends a bit on what area you look at, of older adults die in a hospital. And why is that a concern? Well, first of all, we know that most people, when you ask them, do not want to die in a hospital. Now we realize that a hospital is the right place to go when people have a lot of healthcare needs. So of course we're going to have people who die in hospitals. We know that. However, there is a proportion of people that really should not and do not want to die in a hospital. So the question becomes, what can we do to change the system so to accommodate those needs? Older adults, overall tend to get less aggressive care. So that's in a way a good news story. So we do not have these heroic measures for the very old as much as for younger people. The question though is the care setting. So still a lot of older adults do die in hospitals, and a lot of them are hospitalized repeatedly before they die, and they're going into acute care hospitals. Many of those hospitalizations occur through the emergency departments. So somebody has some healthcare need, they enter the emergency department and then are admitted into a hospital. So we're getting back to not so much maybe what care do they receive, but where do they receive it and what kinds of needs do they have. Why is somebody who is living in a nursing home getting admitted into an acute care setting, possibly, probably via the emergency room, and then is dying in that setting? If you think about this older person, this is likely a person who is very elderly, very frail, probably has dementia, so is already confused and is now experiencing a change of setting. There's different people, confusing, an ambulance trip to an emergency department and then being admitted over into an acute care ward, medical ward, what have you. So it is disruptive, it's stressful on top of the needs. So can we not provide care for those people in the nursing home, or have a different setting that is more home-like, that is more comfort-oriented? We have made a lot of progress in terms of cancer care and the palliative care, so the comfort care for certain groups of people, but most older people don't fall into that category. So we don't have good alternatives. So I think we really need to take a careful look at what is more appropriate. Clearly people do need some form of care. We know that. We also know that even if people don't necessarily die in a hospital, there's these hospitalizations at the end of life. There's something needed, but it's not the acute care setting that we need, because an acute care setting is really set up for treatment. It's treating single problems, and that's not what the older person needs at that point. There needs to be support, there needs to be care, and the acute care setting is not the place.